All right, Mount Sinai Hospital in New York, where they're wearing outside as doctors are waiting for Ebola test results on a certain patient inside. Betsy McCaughey, who's worried our hospitals are not prepared for this kind of thing. She's the founder of the Committee to Reduce Infection Deaths. Why are you worried?
Well, hospitals that can't control common infections like MRSA, VRE, C. diff, almost household names now, are not prepared to contain Ebola either. And the fact is that all across this country, hospital infections kill an estimated 75,000 Americans a year because of unclean hands, inadequately cleaned equipment and rooms, and lax procedures. So hospitals are unprepared for this challenge. And the fact that this particular disease is not airborne is almost irrelevant, because the #1 hospital infection in this country, C. diff, Clostridium difficile, is also spread with bodily fluids, namely diarrhea. Invisible particles of diarrhea get on all the surfaces in the hospital, and then another patient comes along and touches the bed rail.
I know, I get your
whatever.
point, for God's sake. All right, so you're saying that just because this isn't airborne or proven to be airborne yet, we're sort of whistling past potentially our own graveyard. This could be very bad, whether it mutates or not.
Well, the danger is that a traveler unknowingly carrying this disease goes to an emergency room at a hospital in this country with diarrhea, vomiting, bleeding, all of the...
Then he's sitting there with 200, 300 other people.
Even if it's just for a couple of hours before somebody recognizes this is a very serious situation and puts him or her in isolation.
But in Mount Sinai, they're running around in hazmat suits and everything else, taking precautions. Is that enough?
Well, it depends on how rigorously they adhere to those precautions. The precautions
here's why I think that's
as good as the adherence.
Here's what's weird about that. They were running around in hazmat suits in Liberia, right? And 2 of those guys contracted
Let me give you an example. The CDC, Centers for Disease Control and Prevention, itself is unprepared for this. In 2003, hospitals in New York and northern New Jersey had a cluster of very serious infections called CRE, carbapenem-resistant bacteria. Killed patients, the mortality rate was 50%. Now that particular infection has spread to hospitals in at least 38 states, and to France and to Israel. The CDC was unable to contain it.
And wasn't the CDC also back during the AIDS crisis responsible for saying all our blood supply was fine? We later come to find it's contaminated. I'm not saying everyone should be batting 1,000, but when I get assurances from federal agencies that all is good, I think there's history to suggest that it's always not that way.
That's right. And the real danger here is to patients and healthcare workers in hospitals that unknowingly receive an Ebola-infected patient.
All right. But for those who knowingly have it, whether it's Emory and Atlanta with the 2
well,
or
they've got a big advantage. They at least know they're dealing with a serious challenge.
And this one in New York where they're looking at that possibility. You're more worried about those who exhibit symptoms later on. It's too late, right? Those hospitals have already been exposed.
That's right. The patients are not contagious until they demonstrate those symptoms, those serious symptoms. But they could be sitting in an emergency vomiting or having diarrhea or sweating
I beg you
profusely.
to stop. All right, that's fine.
And
all right.
It would be contagious.
Right. You're very smart, and you know every single medical acronym known to man. We'll have more right after this.